Dr. Ulin, let's get into the first question. This comes from Patrick of Kahului. He says that he has asthma. And would the symptoms of an asthma attack be the same as symptoms of coronavirus? What are some things I should be concerned of if I have asthma?
That's great. Good question, Patrick. Asthma, really good. You know, we see a lot of asthma here in Hawaii. It's very common. During an asthma attack, you often feel a shortness of breath, very tight-chested. People will tell you it feels like the elephant sitting on your chest. And, you know, usually you'll do your inhalers after that and get some relief. With COVID, these can also happen. You can feel the same. The difference is usually with COVID-19, you're often going to have a fever, maybe some body aches, sore throat, headache, nausea, and a lot of folks really feel really tired. And that's probably due to the immune response and decreased oxygen in your blood. So if it feels like, really and truly, if it feels like more than your usual asthma attack, it probably is. And if you're having those symptoms, please get in touch with your doctor and check in with your medical care, because it's really important to catch up. You know, the second part of the question I think is even more interesting, and that is, do folks with asthma have a bigger risk with COVID-19? And I think that's really been interesting. The CDC has always stated that people with moderate to severe asthma probably are at higher risk. But there's been an article just in the last week from the American Academy of Allergy, Immunology, Asthma that recently put out a special article on COVID-19, and they challenged that idea. Their data says that asthma is not a strong risk factor for severe COVID-19, and that's just a big yay, because, you know, we have so much asthma.
True.
The data may change, but, you know, I think, Patrick, the asthma is probably not an increased risk factor as long as you keep doing your meter dose inhalers the way your practitioner informs you. You should be doing pretty good with that. I think the other thing that you might have seen in the literature right now is there's been some talk in the newspapers and all about using steroids, and that may make COVID-19 worse. And you know, our asthmatics frequently are on controller medicines. The controller medicines are perfectly safe. Please don't stop your controller medicines unless you've talked to your provider and they've asked you to do that.
Want to thank Patrick of Kahului. Hopefully that answered his question. All right, Dr. Ulin, what is Maui Health doing to prevent the spread of infection at its facilities?
Thanks. That's a good one. You know, we've been taking proactive steps for weeks now to reduce the risk of infection among our staff, our patients, the physicians and providers who work at our facilities. We've instituted a no visitor policy with few exceptions. We have pre-screening at all of our hospital entrances and emergency room entrance. We've canceled all non-emergent and urgent procedures as well. This has helped reduce the number of patients and visitors in our hospital and ensures we have both the capacity and the equipment to take care of everyone for the most critical times that are coming. We emphasize that folks who feel sick need to stay home. That goes for everyone who works in an essential role. I know that many of us feel like we can't let others down by not coming into work, but staying home when you're sick is so important.
True.
We've also canceled all of our large meetings and travel and increased the use of remote work among our staff to promote social distancing. I think right now there's a ton of communications going out, both inside the hospital and out, that is becoming changing and becoming updated as this COVID-19 spread, and talking more about what we can do for our patients. And the main thing is to look at what the CDC, the Center for Disease Control, is doing. They are updating recommendations weekly, frequently daily, about things we can do and protection we can take. You know, all these protocols are in place to address situations where not only the community, but also our employees and physicians who are exposed to the virus, so we can protect them and basically keep them at work, because we're really going to need them with what's coming.
That's true. All right, Dr. Ulin, final question. You know, it is a very stressful time for those who are who are working, especially there in the health department, and also those who are not. Are there mental health resources for me and my family to help us cope with the stress?
Great question. This is such a stressful time. It's just amazing, isn't it?
Yes, it is.
For most of us, our lives have been just upended by this virus. We're worried about our parents. We're worried about our grandparents, our loved ones, our friends who might be at high risk for complications. And on top of that, our kids are at home. So just please hang in there, Mom and Dad. I know how stressful that is, too.
Yeah, true.
If you're working from home, frequently it feels like you're working more than you ever have. And I know that's because the situation is so out of the norm and you've got everything else going on top of you. It can feel really uncomfortable and add to the stress that you're feeling right now. And then on top of everything, we got all this financial uncertainty that we're all feeling. And I know it can be just overwhelming.
Yeah.
Fortunately, there's great support out there. Many of you belong to companies and organizations that have employee assistance programs. They're available. Now's the time to take advantage of these services. Please don't be shy. There are also many free resources provided by local and national agencies to help with stress and other mind and mood issues, as well as some really good internet-based services. Here in Hawaii, to get Hawaii-based resources, call the COVID information hotline by dialing 211 from any local phone. Let me say that again, the COVID information hotline, dial 211 from any local phone. I guess in finishing, I just want to say, I really want to stress to everyone they have to practice self-care.
Yes.
It's so important to take care of yourself during this time of taking care of everyone else. Please keep moving. Please keep washing your hands. And I think for many of us, you need to stay connected with your support group, whether that's your friends, your family, or your coworkers, but you have to do it virtually. So our telephones, our video chats, they're lifelines for many of us.
Mm-hmm.
So I think self-care is just so very important for your physical and mental health. Please reach out for support.
Dr. David.
Yeah,
Go ahead. No, you go ahead.
I was just going to say, I just would love to reach out with a plea to remember that we're all on an island, and we all are here to take care of each other. We at Maui Health feel a deep responsibility to our community to be there for everyone. Please help us by following the recommendations for social distancing, hand washing, and isolating yourself if you feel sick. We can all help save lives by doing the right thing. And finally, I'd just like to thank you for taking the time to let us come talk on your airwaves and for joining the Maui Health Ohana and taking care of our island. We really appreciate you guys.
Well, by the time this is all over, Dr. Ulin, Maui Health and KPOA, we will be Ohana. So thank you again on behalf of all of us here. And we'll be talking more in the upcoming weeks. Thank you, Dr. David.
Thank you, sir. Appreciate it.
Aloha.
Aloha.